All right, everybody, welcome back to the deep dive.
Yeah.
Today, we're going to be tackling something that's super important. We're going to be taking a deep dive into asthma.
Okay.
And we're going to be using some of the most up-to-date medical guidelines and resources out there.
Sounds good.
Now, this deep dive is for everyone. Maybe you're dealing with asthma personally.
Yeah.
Or maybe you're prepping for like a medical presentation. Or, hey, maybe you're just super curious about this condition. You know, asthma's so common.
Mm-hmm.
But regardless, you're in the right place, because by the end of this deep dive, you're going to have a much clearer understanding of asthma, how it's managed. You know, we're going to uncover some key facts, we're going to bust some myths, and hopefully you'll walk away with some aha moments.
All right. So to kick things off, I think it's fascinating how asthma, it's so incredibly common, but it presents so differently in each individual.
Yeah, that's what makes it so tricky.
Right.
So let's get back to basics for a second.
Sure.
What is asthma?
Well, simply put, asthma is a chronic inflammatory disease that affects the airways in the lungs. So these airways, they become inflamed.
So they're like red and swollen.
Exactly, red, swollen, and irritated.
And this makes the airways narrower.
That's right. And that's what makes it difficult for air to pass through.
Okay.
Which leads to those classic symptoms: wheezing, shortness of breath.
That tight chest feeling.
Exactly. And of course, the coughing.
Okay, so the airways get narrower because of this inflammation.
Mm-hmm.
But what triggers the inflammation in the first place?
Well, that's where things get a little more complicated, because the triggers can vary so much from person to person.
Right, you know what I mean?
It really is a puzzle. So for some people, it might be exercise, running or intense sports.
Mm-hmm.
That brings on this thing called exercise-induced asthma.
Okay, interesting.
For others, it might be allergens, like pollen dust, mites, pet dander.
Mm.
Even changes in the weather can trigger an asthma attack.
Wow, so many things. And that makes sense why everybody's asthma is a little bit different.
Absolutely. It's not a one-size-fits-all kind of thing.
So how do you figure out, like how bad somebody's asthma is?
Well, that's where we talk about asthma severity and control.
Okay.
So it's not just how often you have symptoms, it's about how severe those symptoms are and how much they impact your daily life.
This makes me think about, how asthma can impact someone's life, beyond the physical, emotionally, socially.
Yeah, absolutely. Imagine planning, like a hike with your friends, but having to back out because you're worried about an asthma flare-up or feeling anxious about traveling because you're not sure how different climates might affect your breathing.
Right.
These are very real concerns for people with asthma.
And it must be incredibly frustrating, to feel held back like that.
It is.
So that must make it even more important to find the right treatment plan right.
It does.
Now, I know our sources talk about a stepwise approach.
Yes.
So can you break that down a little bit for us?
Absolutely. So it's a very personalized strategy.
Okay.
Think of it like finding the right pair of shoes. You wouldn't start with hiking boots. For a quick jog around the block.
Right. Now you need the right shoe for the job.
Right. Similarly with asthma, we start with the least amount of medication that's needed to control your symptoms. And we only step up to more intensive treatments if those aren't doing the trick.
Gotcha. So there are different steps.
Yeah.
And each step is more intense.
Right. It's like climbing a staircase. You go up to the next level. If you need more treatment.
If the previous one wasn't working.
Exactly.
So how do you know which step is right for you?
Well, there's a tool called a peak flow meter.
Okay, so peak flow.
Yes.
It's all about how well your lungs are working, right?
Precisely. It measures how quickly you can exhale air.
Okay.
So, think of it like this. Imagine you're training for a marathon.
Okay.
And you notice your peak flow consistently dips below 60% of your personal best. After your runs,
right,
this could signal poorly controlled asthma, and we would need to adjust your treatment plan.
Okay, so peak flow helps you track your asthma. Makes sense.
Mm-hmm.
But what do you do when you experience a flare-up?
That's where having a personalized action plan is crucial.
Okay.
It's like a roadmap for what to do if your asthma symptoms worsen.
So this is what they call exacerbations.
Yes.
And they range from mild to moderate to severe.
That's right.
Okay, can you break those levels down a little bit?
Sure. So with a mild exacerbation, imagine someone who's a bit out of breath.
Okay.
But can still talk in full sentences. Their breathing might be a little bit faster than normal. They might need their quick relief inhaler a bit more often.
Okay.
But their peak flow and oxygen saturation are likely still within their normal ranges.
Okay, so that's mild.
Mm-hmm.
What about severe?
Severe is a very different picture. Now imagine someone who's hunched forward, struggling to breathe, unable to speak in full sentences.
Okay.
Their breathing is very rapid, their peak flow is significantly below their best, and their oxygen saturation has dropped dangerously low.
Wow.
This is a life-threatening situation that requires immediate medical attention.
Yeah, that sounds really scary. I can totally see why having that action plan is so important.
Yeah, it is. A good action plan will outline exactly what to do in each scenario, like which medications to take, when to seek medical attention, even emergency contact information.
So important. Okay, so let's just recap what we talked about, for our listeners. We talked about how asthma is a chronic inflammatory condition.
Yeah.
It affects the airways, making it hard to breathe. We also learned about, understanding your triggers.
Yeah.
The different levels of asthma severity, the stepwise approach to finding the right treatment.
And of course, the peak flow monitoring and the personalized action plan to guide you during those exacerbations.
Right. It's like having a personalized toolkit.
Exactly. For managing your asthma.
Okay, well, before we wrap up, I have one final question for you.
Okay.
If you could offer one piece of advice to someone living with asthma, what would it be?
I would say knowledge is power. The more you understand about your asthma, including your triggers and how to manage your symptoms, the more empowered you'll be to live a full and active life.
I love that. Well, thank you so much for joining me on this deep dive into the world of asthma.
My pleasure.
We hope you found it informative and insightful. And until next time, keep exploring and learning.